In this video, we can discuss about antipsychotic drugs. This is also known as neuroleptics, ataraetics or major tranquilizers. So let's start with the definition of antipsychotic drugs. These are the drugs which are useful in all type of functional psychosis, especially for the treatment of schizophrenia. In schizophrenia, there will be a splitting of perception, interpretation from the reality, hallucination, inability to think coherently. It is also known as tranquilizer. It is an old term meaning a drug which reduces mental tension and produce calmness without inducing sleep or depressing mental faculties. So we had already discussed about different mental illness and what are the different reasons for mental illness. Let me just refresh what is the reason for psychosis. This is due to increasing dopamine which is a neurotransmitter in the brain. So now coming to the classification of antipsychotic drugs or neuroleptic drugs. It is mainly classified into phenothiazine, butyrophenones, thioxanthines, other heterocyclic compounds and atypical antipsychotics. Phenothiazine is again classified into aliphatic chain, CHLORPROMAZINE and triflupromazine, and piperidine side chain like thioridazine and piperazine side chain with the trifluperazine and fluphenazine. Butyrophorone is again classified into haloperidol, trifluperidol and penfluperidol, thioxanthines, flupentixol and other heterocyclic compounds like pimozid, loxapines and atypical antipsychotic clozapine, risperidone, olanzapine, quetiapine, aripiprazole, ziprasidone, amisopride and zotapines. And the most important drug in this classification is chlorpromazine. This is usually seen as an essay question as whole. Classify or write the pharmacology of antipsychotic drug, classify mechanism of action, ADR and uses of chlorpromazine, or as 5-mark question, pharmacology of chlorpromazine. So that is the classification. Now difference between the atypical and typical antipsychotics. All the drugs which drug other than atypical antipsychotic drug is known as typical antipsychotics. All these are the potent D2 blocking agent, that is the mechanism of action. So we will discuss the mechanism of action of antipsychotic drugs. Mechanism of action of all the antipsychotic except clozapine, that is an atypical antipsychotic, have potent dopamine D2 receptor blocking action. Phenothiazine and thioxanthines also block D1 and D3 and D4 receptors, and atypical antipsychotic drugs which will block 5-HT1 and 5-HT4, 5-hydroxytryptamine receptor 1 and 4, and it have a weak D2 blocking action. Okay, so this is the pictorial representation of synaptic cleft where the synaptic vesicle containing dopamine will released, and this dopamine will come and bind with the receptors, dopamine receptor. There are different dopamine receptor which is classified as D1 like and D2 like. In D1 it is D1 and D5 dopamine 1 and dopamine 5 receptor, and D2, D3 and D4 are D2 like. All these are G protein coupled receptor, and the most important receptor in the antipsychotic drug is D2 receptor. So the typical antipsychotic drugs will block the D2 receptor, and atypical antipsychotic drugs have weak D2 blocking action as well as major 5-HT1 blocking action. Now what are the actions of chlorpromazine? So why do we prefer chlorpromazine as antipsychotic drug? Because this is considered as one of the prototype drug in the antipsychotic drugs. So it have majorly 4 different receptor action: dopamine receptor, alpha 1 adrenergic receptor, H1 receptor and muscarinic receptor action. So by the dopaminergic receptor blocking action of chlorpromazine, In limbic system or mesocortial area, it will produce antipsychotic effect, so it can be used for the treatment of psychosis, especially schizophrenia. Due to the blocking of dopamine 2 receptor in chemotrigger zone, it will produce an antiemetic effect. Due to the blocking in basal ganglia, it will produce extrapyramidal side effect that we will discuss in detail in later. Then in pituitary gland, by blocking with the dopamine receptor, it will produce prolactin release. And due to blocking in alpha adrenergic receptor, it will produce postural hypertension, tachycardia and palpitation. And due to block in H1 receptor, it will produce sedation, antipruritic action, and due to the blocking of muscarinic receptor, atropine like action, dry mouth, blurred vision, constipation, urinary retentions are important actions of chlorpromazine. So in CNS, in normal person who don't have any psychosis, it will produce paucity of thought, psychomotor slowing, emotional quietening, reduction in initiatives and tendency to go off to sleep, from which the subject is easily arousable. So D2 blocking will produce extrapyramidal side effect. That is why antipsychotic drug is also known as neuroleptic drugs. In psychiatric patients, chlorpromazine will reduce irritational behavior, agitation, aggressiveness, and it will control the psychotic symptomology, and disturbed thought behavior are generally normalized, anxiety is relieved, hyperactivity, hallucination, delusions are suppressed. So that is the effect in the CNS of chlorpromazine. Now in ANS, it will produce alpha adrenergic blocking action, so that it will produce postural hypertension, and it also have an action like local anesthetic as that of lidocaine and lignocaine, but it is not used for this purpose because of irritant action. Now in CVS, cardiovascular system, it will produce hypotension and it will depress the heart, so it will produce an ECG changes. And in skeletal muscle, do not have a direct action. In endocrine system, it will increase the prolactin release and tolerance, that is the another action to the sedative as well as hypotensive action developed within few days. Now let's see what are the adverse drug reactions of chlorpromazine. In CNS, it will produce drowsiness, lethargy, mental confusion, tolerance to sedative effect may develop, and increased appetite and weight gain. In cardiovascular system, it will produce postural hypotension, palpitation, inhibition of ejaculation, and in anticholinergic system, it will produce dry mouth, blurring of vision, constipation and urinary hesitancy. In endocrine system, it will produce hyperprolactemia, and in metabolic effect, elevation of blood sugar and triglyceride level, so it will lead to hyperglycemia and hypercholesterolemia. So these are the different adverse drug reactions of chlorpromazine. Now the most important adverse drug reactions of chlorpromazine or typical antipsychotics is extrapyramidal side effect due to the blocking of dopamine 2 receptor. So it may produce different ADR like Parkinsonism, in which the rigidity and tremor and hypokinesia and mask-like facies. Acute muscular dystonia, which will produce bizarre muscle spasm. Then akathisia, restlessness, feeling of discomfort, apparent agitation manifested as compelling desire to move about and without anxiety. Malignant neuroleptic syndrome, marked rigidity, immobility, tremor, hypothermia, semi-consciousness, fluctuating BP are examples. And Dravet dyskinesia, in which it will produce purposeless involuntary facial and limb movement like constant chewing. So these are the different adverse drug reaction, and this is the most important adverse drug reaction of chlorpromazine. So by the treatment with antipsychotic drug for a prolonged time, the patient may be a Parkinsonian patient. അപ്പോൾ കൂടുതൽ നമ്മൾ ഡ്യൂറേഷൻ കൂടുതൽ കാലം നമ്മൾ ഇത് യൂസ് ചെയ്ത് കഴിഞ്ഞാൽ ആ ആൻറ്റിസൈക്കോട്ടിക് പേഷ്യൻറ്റ് സൈക്കോട്ടിക് ഡ്രഗ്സ് എടുക്കുന്ന പേഷ്യൻറ്റ് പാർക്കിൻസോണിസം ഡെവലപ്പ് ചെയ്യാനുള്ള ചാൻസ് ഉണ്ട്. ഓക്കെ, now what are the different drug interaction of antipsychotic drugs? All the neuroleptics or antipsychotic drug will potentiate all the CNS depressant like hypnotic, anxiolytic, alcoholic and opioid and antihistamines. അപ്പോൾ ഇങ്ങനെയുള്ള ഡ്രഗ് എടുക്കുന്ന ആൾക്കാർക്ക് ആൻറ്റിസൈക്കോട്ടിക് ഡ്രഗ്സ് കൊടുക്കുന്ന സമയത്ത് നമ്മൾ നല്ലവണ്ണം ശ്രദ്ധിക്കണം. And it will block the action of levodopa and direct dopamine agonist in Parkinsonism because all the antipsychotic drugs will block D2 receptor. ഡോപ്പമിനും അതുപോലെ ഡോപ്പമിൻ അഗണിസ്റ്റ് ഒക്കെ D2 റിസപ്റ്ററിൽ ആക്ട് ചെയ്യുന്ന ഡ്രഗ്സുകളാണ് ടു ട്രീറ്റ് പാർക്കിൻസോണിസം. അപ്പോൾ അങ്ങനെയുള്ള ഡ്രഗ്സുകൾ കൊടുത്തു കഴിഞ്ഞാൽ നമ്മൾ ആൻറ്റിസൈക്കോട്ടിക് ഡ്രഗ് അതിൻ്റെ കൂടെ കൊടുക്കുമ്പോൾ ഇതിൻ്റെ ആക്ഷൻ എന്ന് പറയുന്നത് D2 റിസപ്റ്ററിനെ ബ്ലോക്ക് ചെയ്യാനാണ്. നമ്മൾ കൊടുക്കുന്ന ലിവോഡോപ്പയും അവിടെ ബൈൻഡ് ചെയ്യില്ല. Now anti hypertensive action of clonidine and methyl-dopa will be reduced due to alpha-2 adrenergic blocking action, and enzyme inducers like barbiturates and anticonvulsants can reduce the blood level of neuroleptic by increasing the metabolism of antipsychotic drug like chlorpromazine. And finally, coming to the uses of chlorpromazine, it is mainly used to treat psychosis, especially for the treatment of schizophrenia, mania, in which mania we will use chlorpromazine with or alloperidol with lithium or valproate, and organic brain syndromes with limited efficacy in dementia and delirium associated with the psychotic features. And chlorpromazine and other antipsychotic drug is also used for the treatment of anti-anxiety or for the treatment of anxiety. Used as an antiemetic, not given unless cause is identified. What is the cause of nausea is unidentified. Now other uses to potentiate hypnotic and analgesic and anesthesia, tetanus. Chlorpromazine is an alternative drug to relieve the skeletal muscle spasm and alcoholic hallucination and Huntington disease. So these are the different uses of chlorpromazine. Now coming to second class of antipsychotic drugs, or it is also known as second generation antipsychotic drugs or atypical antipsychotics. അപ്പോൾ ഫസ്റ്റ് നമ്മൾ പറഞ്ഞ ബാക്കി 5 ക്ലാസിഫിക്കേഷനും ഫിനോതയാസിൻ, ആലോപെരിഡോൾ, ബ്യൂട്ടിറോഫെറോൺസ് ഒക്കെ വരുന്ന എല്ലാ ക്ലാസിഫിക്കേഷനും നമ്മൾ ടിപ്പിക്കൽ ആൻറ്റിസൈക്കോട്ടിക്സ് അല്ലെങ്കിൽ കൺവെൻഷണൽ ആൻറ്റിസൈക്കോട്ടിക്സ് എന്നാണ് പറയുക. അറ്റിപ്പിക്കൽ ആൻറ്റിസൈക്കോട്ടിക് അല്ലെങ്കിൽ സെക്കൻഡ് ജനറേഷൻ ആൻറ്റിസൈക്കോട്ടിക്സിൻ്റെ മെയിനായിട്ടുള്ള മെക്കാനിസം എന്ന് പറയുന്നത് വീക്ക് D2 ബ്ലോക്കിങ്ങും പൊട്ടൻ്റ് 5-HT2 ബ്ലോക്കിംഗ് ആക്ടിവിറ്റിയുമാണ്. So it will not produce extra pyramidal side effect. That is the important thing in second generation antipsychotic. നമ്മൾ ടിപ്പിക്കൽ ആൻറ്റിസൈക്കോട്ടിക്സ് കുറേ കാലം കൊടുത്തു കഴിഞ്ഞാൽ പേഷ്യൻറ്റിന് പാർക്കിൻസോണിസം ഉണ്ടാവും, കാരണം ഡ്യൂ ടു ദ എക്സ്ട്രാ പിരമിഡൽ സൈഡ് എഫക്റ്റ്. അപ്പോൾ നമ്മൾ എന്ത് ചെയ്യണം, അറ്റിപ്പിക്കൽ ആൻറ്റിസൈക്കോട്ടിക് അല്ലെങ്കിൽ സെക്കൻഡ് ജനറേഷൻ ആൻറ്റിസൈക്കോട്ടിക്സുകളാണ് നമ്മളപ്പോൾ പ്രിഫർ ചെയ്യുക. ഡ്യൂ ടു വീറ്റ് D2 ബ്ലോക്കിംഗ് ആക്ഷൻ ഇറ്റ് വിൽ നോട്ട് പ്രൊഡ്യൂസ് or there will be a minimal extra pyramidal side effect. And atypical antipsychotic drugs will produce mainly 5-HT2 blocking activity. Now these are the drugs in the atypical antipsychotic drugs: risperidone, clozapine, olanzapine, quetiapine, aripiprazole, ziprasidone, then amisulpride and zotapines. These are the different mechanism of action. Weak D2 with the 5-HT3 alpha 1, alpha 2 and H1 blocking action. So all the action of atypical antipsychotic drug will be same as that of chlorpromazine or typical antipsychotic drugs, except it will not produce extra pyramidal side effect, and uses also will be same as that of chlorpromazine. So I will not repeat the uses and adverse drug reaction of atypical antipsychotic drugs. This will be same as that of typical antipsychotic drugs. So that is all about antipsychotic drug, especially used for the treatment of schizophrenia or functional psychosis. Hope it is clear. Thank you for watching this video.